you, everybody. Good afternoon, and welcome to our weekly COVID-19 media briefing with Montgomery County Executive Marc Elrich, Dr. Travis Gales, who is our health officer, and also Dr. Earl Stoddard, who is the director of the Office of Emergency Management and Homeland Security. I'm Lorna Vigili, Hispanic Public Information Officer for Montgomery County Government. And members of the media, you should all have already permission to record. If you do not, please ask for it. We have a hard stop this afternoon at 1 p.m. And with that, let's get started, Mr. County Executive.
So good afternoon, everybody. We are now going into the 14th month, the 13th month of COVID. It's been a long time. And I just want to start by saying, our cases yesterday were 108 new COVID cases. Our positivity rate was 3.04. It makes us the second lowest positivity rate in the state of Maryland. And our case rate was 10.64, which is the fifth lowest case rate among the counties in Maryland. And it's the lowest of all the large urban counties. The other counties that are lower than us are generally really, really small. Yesterday, 10,000 county residents received their first doses. The county health department and partners did 3,300 vaccinations. Today, with today's vaccination clinics, more than 400,000 county residents are going to will have received their first doses of COVID-19 vaccine, and more than 226,000 are fully vaccinated. That is 25% of our residents. Montgomery College Germantown opened today. I was there early this morning, watching people get ready for this. This is the state's mass vaccine site, and we were really happy yesterday to have Governor Hogan visit this site and did a little tour of it. And I want to thank the governor and the state of Maryland for their collaboration on this mass vac site, as well as Montgomery College and Holy Cross Hospital. And I want to say that, the governor's people gave a lot of credit to our team in terms of getting this site set up and the work we did. And I just want to acknowledge the work that our folks did to make this possible. In the state, we've found that 5 out of 7 of the top vaccine sites for Montgomery County residents have been outside of the county. So county residents have been using the mass vaccination clinics that are around the state. And I guess the hope is that, with the mass vaccination site closer to home, more of our residents are able to access the site here. The governor also opened the Greenbelt site yesterday, and in our conversation, he said they were reserving 25% of the vaccines over there for county residents. It's an area that is close to the east side of the county, so it's a logical place for residents to be able to get to. And so this is more opportunities for our residents to get vaccinations. We did get a bit of bad news yesterday. The governor also mentioned that the previous evening, I guess one of the federal agencies announced that the Johnson & Johnson vaccine deliveries were going to be substantially lower than had been anticipated. And so some of the plans that were made for the arrival of Johnson & Johnson and how that would impact the schedules over the next 3 or 4 weeks are going to wind up getting revised. And it's not clear that those doses have been replaced by other doses from other companies. And the problem is, a lot of our assumptions about how fast we're able to get everybody vaccinated. In fact, all our assumptions are predicated on the arrival of vaccines. So anytime we're told that there's going to be a delay in vaccines, it ultimately plays out at the local level. So we're hoping the delay is temporary. Frankly, we're still waiting for Moderna and Pfizer to ramp up the vaccine production to the level that I think everybody thought we were going to be at by now. But hopefully we'll get there sooner than later. Everyone should please pre-register on the county site. It's going to make the process a whole lot smoother. I'll remind people again, for people who visited this site early on and were told you could only register if you were eligible, that has dropped. And so anybody in the county can now register. We will call you as we get to you through the queue. but it's important to get registered. It will be a lot easier to find and a lot easier to get you a dose of vaccine in your arm if you're on this pre-registration list. So please get yourselves pre-registered on the county site. That is really important to us. But please also don't confuse eligibility with availability. And to put this in context, we have about 500,000 more people to vaccinate the adult population and those down to 16. With the mass vaccination site, we might be close to being able to put out 50,000 doses a week between that and some of the other things. 50,000 doses a week and 500,000 people now competing for those doses, you will not get them quickly. We've been telling people this all along, that eligibility does not mean availability. The number of doses is far, far less than the number of people who are eligible to get those doses. So I think, scheduling is going to continue to be an issue. The state still has not initiated a single scheduling portal for all of the providers. So we have our portal. The other portals are not coordinated with our portal, and our information isn't available to them. So you will continue, unfortunately, to either have to go to the state site for registration for max vaccination or through the county, but other sites still have doses, but you have to go to the individual sites to access them. I wish we were allowed to change that, but this is the way this has been set up by the state. And I regret we weren't able to get to a better system yet. We continue to work on our equity and our goals to make sure that all communities are receiving their proportionate doses. But I want to remind people, we only control 1/3 of the supply of the doses that are distributed in the county. And so we have an equity plan, and we are, working and executing on that equity plan. 2/3 of the doses do not necessarily follow an equity plan, and particularly when it comes to the pharmacies and the grocery stores. So we are hoping that, as the governor ramps up efforts to have a statewide equity plan, that ultimately there's a requirement that everybody who's giving doses follow an equity plan, because if the county is the one that's following it here and we're only controlling 1/3 of the doses, we really can't say we've got a countywide plan. We have a plan for our doses. We need everybody else to get on the same page, and hopefully that will come about sooner or later. We do need a uniform, consistent policy across the state. I want to remind everybody that testing continues to be critically important. Kids are going back to school. I know there's an enormous desire in seeing, the children back in school. So that means that we have to control community transmission. All of the guidance on whether school can be successful or not hinges on doing this in a climate of low community transmission. So everything you do to keep transmission down is important. Testing is important because we need to know where clusters of cases are occurring and also what activities are creating cases. And testing is also important because we're dealing with new variants. We know that the British variant is taking over in the state of Maryland as the primary variant, but we still have a presence of the Brazilian variant. That variant is more worrying even than the British variant, and it's important for us to know where they are so we can target some of our actions to make sure we're better able to contain the spread of the variants. So please get tested. If you've been tested once, you can get tested again, because your first test is no guarantee that 2 weeks later you couldn't be exposed to it. So ongoing testing is important. If you've traveled, please test. And you should look at, my advice is to look at the state maps, either on the Washington Post or the New York Times. And if you see some of these states that look bright red, don't go there. You simply are putting yourself in risk. Some of these states, they've relaxed mask requirements and other requirements. So if you're going to travel safely. Avoid places that are likely to be hotspots. You don't want to bring that back to your family or your friends. And just in general, please continue to be careful. We are still encouraging mask wearing, and hope that, we get to the point where we're less worried about all this, but we're not there yet. We're moving in the right direction and we're making progress, and we are going to get there together. But let's protect ourselves. Let's make sure our kids are safe to go to school, and let's make sure that as many of us are around for the live celebrations that we'll all be happy to engage in once we get past this. It is probably, we are in a period of time now when you can see the light at the end of the tunnel. You've been patient through all those months when we had no idea when this is going to end. We're asking people to be patient now for a little longer as we, go through the final stages of vaccinating everybody. So I'll stop there and thank you.
Thank you, Mr. County Executive. Dr. Gales, do you have some opening remarks?
Good afternoon and happy Thursday to everyone. Always a pleasure to be here with you all. Thank you to all of the collective efforts that have gone into standing up the multiple vaccine sites, continuing our testing apparatus, and all of the continued outreach within our communities. I don't actually have a ton to add beyond the county executive's remarks today. He highlighted where we stand in terms of our levels of community transmission. And one thing I want to emphasize is that we do talk a lot about community transmission from the perspective of test positivity and case rates and number of cases and hospitalizations. But as was pointed out in a recent article that was published in Lancet yesterday, in fact, we are beginning to develop a better understanding of what the long-term side effects of having a COVID infection. And there were a series of articles that highlighted the neurological and the mental health impacts of having a COVID diagnosis. And so it just underscores that we have to think about when we're coming up with policies and keeping the level of restrictions that we have in place to keep people safe. It's not just a question of life or death. It is also becoming a question of what's the long-term quality of life that is associated with the COVID diagnosis. So we continue to think through those things. We obviously will continue to follow the trends. The county executive mentioned we are seeing increasing evidence that the B117 variant, or the UK variant that it has been also deemed as, is becoming the predominant strain of COVID-19 in the state of Maryland. And we do have presence of that along with 4 or 5 other variants, as we've talked about previously. Also wanted to say a special kudos to the teams that have been supporting the vaccine efforts. As the county executive mentioned yesterday, we had a record number of folks who received shots in arms from the county apparatus, including, I will correct one thing, it was nearly 3,300 first doses that were administered yesterday. And when including second doses, we had well over 4,500 doses administered across the board. So we thank you for your patience. We will continue to refine our measures, get as many doses out as possible, and work with our residents to make sure they're covered and protected. Thank you, and happy to answer any questions you may have.
Thank you, Dr. Gales. Dr. Stoddard?
I just want to say a few things about the mass vaccination site, and as Dr. Gales and county executive said, I want to acknowledge the work of the county apparatus, the state, Holy Cross Health, and Montgomery College. Obviously, it's been a joint effort to get the site up and running as a county site, and now transitioning into a state mass vaccination site today. For just some of the details on the transition today, obviously there are 5,000 Johnson & Johnson doses dedicated to the site so far from the state. We hope to hear on Friday about what the next allocation for next week would be. In light of the reduction that the state received in the Johnson & Johnson allocation, and just to clarify something the county executive said, Secretary Schrader did say there was a 33% reduction in the total federal allocation across all vaccine types to the state of Maryland this week, meaning that there will be across-the-board cuts next week. They've already told us there will be across-the-board cuts next week to all vaccine recipients, and we just don't know how severe that's going to be. And obviously, when we're starting at 5,000 for a partial week this week, if we're cut below 5,000 at the mass vaccination site, that will impact certain days of availability. I think that's pretty obvious. And we'll know more about that allocation by the end of the week, we think. And so obviously, we'll look to expand the hours of operation, but we'll only do so if we've got vaccine to offer at the mass vaccination site, as is true at all the other sites. We did receive word there are approximately 70,000 individuals who have pre-registered at the state level who have preferenced as their first choice or second choice the Germantown site. And so obviously we've got a significant pool of individuals to pull from for the state portion of the allocation. And for the county allocation, we've still got about 150,000 people in our pre-registration list who have not been vaccinated. So we're working through that list, both for our portion of the Germantown site, but across all the vaccination sites. 150,000 seems like a large number. We know we have more than 400,000 people in Montgomery County who are still eligible to receive the vaccine today and for whom have not been vaccinated. So we need to keep encouraging people to pre-register so that we can build up that database, and so that when we have vaccine available, we've got people to invite to our clinic opportunities, whether they be at the mass vaccination site or across all of our opportunities. So that's all I wanted to talk about today, and happy to take some questions.
Thank you, Dr. Stoddard. And let's get started with the questions. First one, Tom Fitzgerald, Fox 5 DC. And he has questions for the county executive and the rest of the officials. Tom.
Hi, everybody. Thanks for doing the briefing as always. I wanted to ask you about movie theaters. Montgomery County allowing 25% capacity at movie theaters. We are hearing from the National Association of Theater Owners, though, that they are concerned that they're not allowed to sell food and drink. And anybody who's ever had that job in a movie theater, as I did when I was a teenager, can tell you that's how movie theaters make their money. So could you spell out what is the concern about having the theaters sell food and drink? And do you think in the near future or distant future, you'd be increasing either capacity rates or reversing that decision on food and drink?
Look, I mean, from my perspective, we are on a clear path to getting to the point when we can start relaxing restrictions. I mean, if we can be putting 50,000 doses of vaccine into people's arms, and we can maintain that for 8 weeks or so, we're in a position where, the virus starts having places to go. We're trying to prevent it from being able to jump. And I think, as everybody realizes, but it's worth repeating, this virus only transmits by us. This is not something lurking in the water or in the air vents, like Legionnaire's disease. This is, I breathe out, you breathe in, you're in trouble. The issue with food in theaters is, A, it's dark. It's hard to make sure that people keep their masks on. B, they're eating, and that means their masks are off. And any of us who've ever sat in a movie theater with a soda in one hand and a bag of popcorn in the other hand, we probably spend a lot of time with our mouths open and putting food in it. So then in that case, the theater becomes like a restaurant, and the restaurants are probably the most dangerous places, short of a workplace where nobody's wearing masks at all. But this is the one place where the 6-foot distancing and all that means less and less if the masks aren't on. So we're concerned that with food being consumed and masks not being worn, this makes this a higher risk than if you were simply going to watch a movie. So that's my layperson's explanation of it. Dr. Gales, I'm sure, could amplify that.
Well, the county executive laid it out very nicely, actually. And sometimes a layperson's explanation is the great explanation, because that's the one that most folks at home understand more clearly. And so, again, consistent with our approach, we are continuing to monitor the numbers and follow the trends and provide guidance in terms of relaxing restrictions that are appropriate with that. I think it's important to note, and what I think should be emphasized in this as much as the other side of it, is that the approach we're taking has resulted in lower levels of community transmission, as the county executive laid out. Now, we're hopeful, obviously, as we get more folks vaccinated and we see those numbers decrease even more, hopefully, that more provisions will be put into place to not only increase capacity, but to also allow for businesses to return to some semblance of normalcy where they were before COVID. We don't, as a public health official, we never want to have to get in the way of interfering with businesses and things like that, but we will stand committed to providing the guidance that we feel will keep our residents as safe as possible. And I know that this is probably, folks are tired of hearing us say this, but we really are near, if the vaccine, capacity increases, if we can hold on just a little while longer, we can get across the finish line where we don't see a fourth wave of cases. And we, quite frankly, we wouldn't have to walk back any of the provisions that we've put in terms of things being open so far.
And if I could just ask one more question, County Executive, obviously this is a big day with the mass vaccination side opening up, but you had been lobbying for this for weeks, and every time we asked Governor Hogan about it, he would say that they didn't want to open up that mass vaccination sites if they didn't have vaccines for it. So here we are today. We're at the point where we're opening the Montgomery College site, and we get this news from Johnson & Johnson. How adversely do you think that this news is going to affect what you hope the Montgomery site will be and do?
Look, I think, if we're really looking at a 33% reduction of vaccines, then the assumption that we could get to 50 pretty reasonably is 50,000 doses a week. We're not going to get there as quickly as we otherwise could. And that means going through 500,000 people could take a couple more weeks, depending how long this lasts. So it's not like it's going to have an impact. It's very frustrating, but any of you followed me, you know how reluctant I am to put dates on things. And I think it's, people raised expectations, talked about all these doses that were coming. And this was back in February. March was supposed to be the month when everybody was ramping up doses and it was going to be the glory days. It didn't happen. And now we're into April. And instead of being told that we're going to have a 33% increase, we're told we're going to be staring at a 33% decrease. So I'm reluctant to promise dates or anything. I do think it's going to have a negative impact. It can't do otherwise.
Thank you.
Thank you, Tom. Rebecca Tan from the Washington Post. Questions for the county executive. Rebecca.
Thank you so much. My questions this time around are not to do with the pandemic. An off-duty Pentagon officer shot and killed 2 people in Takoma Park yesterday. Have you been briefed about the incident, and are there any details you can share? And I have a follow-up question.
I was briefed, but I was briefed based on not enough information. So I got basically what appeared in the news reports. That much I know. If the news reports are accurate, this is really, really troubling. You can't shoot people for property crimes. That you can't do that. And so it's really disturbing. I mean, if people were trying to break into a car and they try to get away, you can't shoot them. That's just flat out true. So I'm very disturbed. And, I don't know if there's any extenuating circumstances. I don't know of any extenuating circumstances. I am really concerned about this. He was an off-duty Pentagon police officer. He had no authority, as I understand it, in Montgomery County, no police authority. The idea that he drew his gun, as opposed to picked up his cell phone and called the police, which would have been a more appropriate response, is troubling also. So I'm just saying this should not have happened unless there's something that none of us have seen so far. This really should not have happened.
Got it. Is the county involved? Can you say how the county is involved in the investigation of what happened, and when do you expect that you're gonna have more details?
I expect there'll be more details today. The state's attorney's office is always engaged, and so they are doing interviews. I understand they're going to be interviewing people. I'm not quite sure who they're interviewing, but that should happen shortly, and then they will make decisions about charging. But I would be surprised if that goes any longer than the end of the day today. And this is a Takoma Park investigation, and they do full investigation services, but they're being supported by the county as well.
Got it. Thank you. Appreciate it.
Thank you. Thank you, Rebecca. Kate Ryan, WTOP Questions for the 3 of you gentlemen.
Thank you. Yeah, as always, depending on who has the answer to this, in terms of the reduction in vaccines, I just want to be absolutely clear. Most recently, we went from 4,500 to 6,600 to 10,000 doses. With the reduction in Johnson and Johnson, what is our weekly allocation? And again, I want to pin down, is the 33% strictly Johnson and Johnson reduction or across the board?
Well, I can answer. I'll take a first stab at this. So we don't actually find out the updated weekly allocations until the end of the week. So typically, as you recall from the earlier stages of vaccine distribution, that range from somewhere between Friday and Saturday over the weekend. We expect that we will get more clarification sent to us from MDH likely tomorrow, hopefully. Now, from my understanding and conversations with MDH, is that the 33% reduction would not necessarily be solely Johnson & Johnson doses. It could mean a cut to other forms of the vaccine to account for and make up for the gap and deficit of the lack of Johnson & Johnson doses available. For example, be able to provide doses to the mass vaccination sites and others. But we hope to get more clarification from the state on what that means, as we've not received that just yet, but hopefully we'll receive that information likely earliest tomorrow.
Okay, and again, 33% reduction in the Johnson & Johnson doses, but Dr. Stoddard, you said across the board?
So it's a 78,000 dose reduction in Johnson & Johnson. And what that equates out to across there was a memo sent from Secretary Schrader and Dr. Gale shared it. It says, and I quote, Maryland will receive 78,000 fewer Johnson & Johnson COVID-19 vaccine doses than previously projected by the federal government and face an overall federal reduction to our first dose to our total first dose allocation of over 33% when compared to week 17's first dose totals. So from last week to this week, there is a net reduction of 33% in the total allocation, including Johnson & Johnson, but also all of the doses. So it's not that, you see a reduction in Johnson & Johnson, it's being made up by Pfizer and Moderna. That's not the case next week.
Okay, and again, just so I can have my timing right, we haven't seen the impact of that yet. We will, if that bears out, we will see that starting Friday, Saturday, Sunday, Monday, correct?
The allocations are typically shipped out on Mondays.
Yep.
And so we won't see the impact until the Tuesday, Wednesday timeframe of next week with clinics. We would likely not impact Tuesday, Wednesday. It just may mean we run out of first dose vaccine earlier. Right, there you go.
Got it. Thank you. I have a totally unrelated question for the county executive, but it is police related. This week, the FOP put out a letter. It was unsigned. It was just an FOP statement saying that anti-police sentiments have made it more difficult for the police to do their jobs. They mentioned what they said were assaults that took place. They say that 75 officers are expected to leave by the end of the year. And they draw a straight line to what they say is, again, anti-police sentiment. Do you have a comment? And have you talked to anyone at the FOP? Did they approach you about this?
They didn't approach me about the letter, but I know that there's been an ongoing concern on both the number of officers who will leave and the difficulty of recruiting officers to the police department. And this is not uniquely a Montgomery County problem. This is a national problem. People are not wanting, not feeling adequately supported. They don't want to, put themselves in the situation they put themselves in without support. They are recruiting is difficult, and many officers have other options and to pursue them. I think there is no doubt that there are issues with police members of departments, but it's not like every policeman is guilty of everything that we associate with some of the worst actors. And I think people have a hard time sometimes separating out what individuals do, and in some cases what organizations have permitted and encouraged and not done anything about, from the actions of individuals. And the stories of what they do that's good, kind of get lost, in the stories of what individual officers do that are problematic. We've undertaken a reimagining police approach here. I just got a draft report regarding police training. It indicates to me that what I've been saying from the beginning is a lot of what we experience go back to training, and that, you know, people do what they're trained to do. And if you're not trained to do things, they don't become part of your repertoire. If you're trained, that's a better chance of that becoming reflective in practices. There's a lot of work we have to do. Again, you know, my view from the beginning is this is not all rogue officers. These are people who got trained, are often doing things that they were asked to do. And now, you know, we've said, we don't want you doing that, but people were trained to do something very different. You know, areas I think of specifically were, you know, harassing kids over pot. You know, we're in a county where the state's attorney doesn't prosecute for that. And yet, you know, we continue to do things we probably ought not to be doing. We, you know, protectual stops, of which some of you have seen the video of a very famous and unpleasant protectual stop. They didn't come about because some rogue officer, the officer who was in the stop was being coached by a superior in another car. So you're not going to deal with this if you think it's only an officer problem. It is a systemic issue. It is, you know, at the core of it, a training issue, and perhaps to some extent a recruitment issue. But we have to do better, and we, you know, but we have to be careful not to, you know, automatically assume that anything that one officer does is reflective of everybody. What made me sad, you're talking, you know, in the case of the 5-year-old kid, I've had people say police officers should never pick up a kid. If a young child walks away from a school, I can't think of anything I could deploy faster than police department to try to find the kid. And the problem isn't that a police officer finds a kid and brings it back to the school. The problem is what happens in that interaction. And I would rather address the interaction so that the interactions aren't anything anybody would be uncomfortable with, so that officers could do what they, you know, what they're out there in the community to do, which is protect the community. And if there's a lost kid, find the lost kid. That shouldn't lead to an event which is problematic. So I hear their issue. They need to hear that the community wants policing in a different way than it's been done before. I think we can reach a place where, you know, where their work is compatible with community's expectations. And that's what we're going to work to do.
Got it. Thank you. And just to pivot back one last time on vaccines and the J&J situation. I know, again, this is a week by week thing. Has anyone at MDH been able to tell the health authorities what the impact of those 15 million is? Is the reduction tied to those 15 million doses that were destroyed because they were, you know, contaminated?
Likely, yes. And we don't, again, we're still awaiting the information from the state to know what the impact will be in terms of the exact number of doses we'll receive as the health department, and also how they will be distributed to the other sites as well.
Okay, and last question. Yesterday, with the 4,500, you said 4,500 doses were allocated or administered yesterday. Is that including the MassVac site or prior to the MassVac site?
So it was including the Germantown site yesterday that, again, was still, I think it's important to note that even though today it's been a state MassVac site,
right?
Yes, we have been running that operation for the last week and stood that up. So it did include the doses that were administered in Germantown yesterday.
Terrific. And what was the capacity at which when, as you say, the county had stood up that site? How many a day were they able to administer there, roughly?
Roughly 1,500.
Got it. Thank you.
Thank you, Kate. And now Brianna Arikusuma from Bethesda Beat, questions for Dr. Gales and also Dr. Stoddard.
Yes.
Brianna.
Dr. Gales, could you confirm the number of variant cases that have been identified in the county and which variants exactly are here?
I don't have the exact total. The state has that information in terms of the exact number. I can get that to you. I don't have it on hand right now, but I can say that we have received reports that we have the following variants present. And forgive me, I probably, for simplicity, I'll just mention the geographic labels with that. We have documented cases of the UK variant, which has the highest number of cases just anecdotally reported in Montgomery County. We have had multiple cases of the Brazilian variant, the South African variant, as well as two strains of the Californian variant, as well as the New York variant as defined by the CDC.
Thank you.
Dr. Gales, you may be able to, I think the state is only testing 20% of samples, is that correct?
Yeah, so not every, thank you for the clarification, not every sample is getting tested. And so the numbers that we see of actual confirmed cases are likely to be artificially low because every positive case does not actually get tested. So in terms, as we've discussed before in previous briefings, in order to approximate the percentage of, or get a sense of what the percentage and impact of those variants are, the state has been doing kind of a random testing of 20% of the positive cases, in addition to those cases that have resulted in positive cases that have been tied to a travel history or an exposure to someone else who's had a confirmed case of the variant strain. So I say all that to say that yes, the numbers are likely to actually really be higher than what are reported, given that every sample does not get sequenced.
Gotcha. Okay, thanks. And Dr. Stoddard, I don't know if you want to answer this question since I know we talked a little bit about this yesterday. Could you explain a little bit more about the breakdown or formula for how invitations for appointments are assigned to people? I believe, and correct me if I'm wrong, 10% of the mass vac site appointments are reserved for county residents specifically. What percentage of appointments are assigned to the high-risk zip codes? What percentage for what percentage of the appointments are randomized, et cetera?
Like Dr. Gales talked about the previous project, what I will talk about in the beginning is, so right now it's not actually percentage. Right now it's 2,100 doses have been allocated for the county's pre-registration lists and the remainder for the state pre-registration list. So right now we're getting 5,000 doses. 2,100 will come from appointments from our pre-registration list. 2,900 will come from the 70,000 or so individuals who have preferenced the Germantown site in the state pre-registration list. Then when it comes to our 2,100, there's a formula that applies by public health and I'll let Dr. Gales talk more about that.
Well, the formula just, it weighs, gives weight to the priority zip codes. Again, we've discussed this before, priority zip codes based upon the number of cases that have been impacted based upon the numbers of cases, the fatality rates, and levels of community transmission. And so extra weight has been given to that. And in some cases, we have used percentages when we've had multiple groups. So for example, when we had opened up opportunities to get vaccinated to those who are over 65, as well as those in essential employee categories, we had a 60-40 split. And then when we had achieved or provided invitations to all of those over 65, and we made the adjustment to age, we adjusted the percentages a little bit to make sure that, again, we had opportunities for the essential employees as well as those based upon age. As we continue to move forward and get more vaccines, I think that we'll continue to refine that as needed, because as the county executive mentioned, eligibility does not mean that there's actually availability of the vaccines to get. So we'll continue to implement the equity strategy to make sure that there's some consideration for individuals who live and work within those higher risk zip codes based upon the epidemiologic data do get some consideration and access to the vaccine.
Right. And with phase 3 opening up, will people in phases 1 and 2 still be the only ones receiving appointment links until we get through those, or are all 3 phases going to be receiving appointment links?
So we'll continue to move through the priority groups as they've been laid out before. And again, this is one of the challenges, is just because you open it up and say everybody's eligible, that doesn't mean an appointment will be available the next day. And so we'll continue to move through those groups as have been laid out by the state, since we've been requested to follow those. And consistent with our policy so far, as we move through those lists that have been provided to us by those who have pre-registered, when we have exhausted those, we will continue to move through to those other age groups. Not necessarily age groups, but those other, let me rephrase that, move to those other groups that are eligible based upon the state's criteria.
When do you believe you all will be mostly through phase 2?
It's hard to say because as we try to predict that, as it has been laid out in this call, is we have situations where there's potential cuts to the doses that we receive. So I would hesitate to put a date on that, because if we say by April 15th we'll be there, at our briefing next week, we'll say, well, why aren't we there then? What I will say is we will continue to move forward as quickly as we can. Again, encouraging all of our residents to pre-register to make sure that we have your information. And then as we move through that, we will work to make those opportunities available as soon as we can, as soon as we have the adequate amount of doses to be able to meet those needs.
Great, thank you.
I believe we had about 35 to 40,000 people pre-registered in the group 3, which is the individuals 16 to 64 with underlying health conditions who we still need to get in. And so depending on what our allocation is for next week, that gives you a sense of how quickly we're progressing through that group.
Great, thank you.
Thank you, Brianna. And those were the last questions from members of the media. Does any other member of the media have any questions? Going once, twice? I guess we are wrapping this up. We're done for the day. Thank you, everybody, for joining us. And we'll see you again, hopefully next week. Stay safe. Good afternoon, and thank you.